Return demonstration, body mechanics.
Hello, hi, good morning. I'm Cheska Lumayag Sironda, BSN 1C, taking up Bachelor of Science in Nursing in North Valley College. So for today's return demonstration, I will be doing the body mechanics. But what is body mechanics? Body mechanics, it is the coordinated use of the body parts to produce motion and maintain their equilibrium in relation to the skeletal, muscular, and the visceral system and their neurological association. In application to body mechanics, I will be doing the sitting, standing, and the other one which I will include in my video.
Okay, let's start. Standing. Stand erect with head upright. Face forward. Shoulders squared. Back straight. Abdominal muscle tucked in. Arms straight with palms forward. Keep feet 3 to 4 inches apart for wide base of support. Place equal support on both legs to minimize strain on weight-bearing points. Sitting. Position the buttocks against the back of the chair. Hips and knees are flexed at right angle to the trunk. Keep trunk and head as in standing position. Place feet on the floor at 90-degree angle to the lower leg. If the chair has arms, flex the elbow and place the forearms on the armrest. Avoid shoulder strain. Log rolling. Equipments, pillow, draw sheet, wedge, and extra linen. Log rolling is used to turn patient who has a spinal cord injury or spinal disorder.
Good day, sir. I am Rose Comag.
And I am Cheska Sironda, your student nurse. So may I ask what is your name, sir?
My name is Martin Lumayag,
Your age
12,
and your birthday?
November 4, 2009.
Okay, sir. We are doing a log rolling today for you to turn and change your position to the other side. Is it okay for you, sir?
Yes.
Determine the reason for log rolling, the patient and the patient's diagnosis. The reason for the procedure should be explained to the patient. Assist that we already raised the bed to comfortable working level. Lock the wheels of the bed. Gently remove the supportive devices around the patient. A principle of body mechanics is to always position the work at comfortable weight to prevent back strain. Provides the bed rolling. Prepares patient for position change. The two nurses should position themselves on opposite side of the bed. The nurse will be grip the rolled draw sheet to roll the patient. With the draw sheet, slide the patient to the edge of the bed opposite direction in which the patient is to be turned. Allow ample room for positioning the patient once he or she is rolled to the opposite side. Place a pillow lengthwise between the patient's leg. Helps maintain the correct alignment of the patient's lower extremity as he is turned. Position the patient's arm to turn the patient to the right place. His left arm to the side and the right arm either flexed above the head or the other side. Proper positioning arms will prevent injury. One nurse should grasp the patient at the patient's shoulder and waist, supporting the neck. The other nurse should grasp the patient at the patient's buttocks and knees supported the leg. Roll the patient in all one motion to a side-laying position. Allow the patient's spine to remain straight and not rotate. Place the patient in correct body alignment and put the wedge against his lower back. The patient is aligned correctly to prevent any constructures and damage to spinal cord. Flex the patient's top leg at the knee and place a pillow under the knee and lower leg. Maximize the patient's comfort and provide good body alignment. Assist the patient's comfort in body alignment. Proper body alignment aids in patient's comfort and assists in preventing complications. Wash your hands. Decrease transit microorganisms and the transmission of pathogens to the others and self. Then record the procedure, time, patient's response, and other observation. Communicates to the other members of the healthcare team and contribute to the legal record by documenting the care given to the patient. Next is transferring the patient from bed to wheelchair. Transferring a patient from bed to chair enables the birth to change his surroundings as well as their position. If the patient is able to tolerate transfer to a wheelchair, the nurse can move him out of the room to another surroundings. For patients who have been rest, this is one of the first activities to resume.
Hello, sir. Good
Inform the
morning. I'm
patient of the
Cheska from
purpose and
University of
destination.
Texas. May I
It
ask you
reduces the
questions?
patient's anxiety and increases cooperation.
So today, sir, I
Assess
am
the
going
patient
to
for
transfer
ability
you
to
from
assess,
your bed to
transfer,
your wheelchair.
prevents
So I'm going to
orthostatic
assist you, sir.
hypotension. Assist that I already lowered the height of the bed to reduce the distance patient has to step. Allow the patient to dangle for a few minutes. Allow time for assessing the patient's response. Bring wheelchair or the chair close to the side of the bed. Minimize transfer distance. If wheelchair, lock its brakes and elevate foot pedals provide stability. Bend at knees, easing the patient into a sitting position. Assist the patient to side of bed until the feet touch the floor, guides and helps the patient maintain balance. Place patient's hands on the arm support of the wheelchair. Allow the patient to gain balance and judge distance to seat. Then, record in nurse note patient's safe transfer to chair. Documents the action taken.